I'm here with Sundari Ravindran. She's from the Achutha Menon Centre for Health Science Studies. Thank you so much for joining me.
Thank you.
What do you consider to be the major challenges in building resilient and responsive health systems?
I think a number of factors have already been mentioned by many people in this conference. But for me, one of the biggest challenges is the increasing privatization of healthcare in many of our countries, and especially the growth of the for-profit private sector, which is taking away both human and financial resources from building affordable public healthcare systems. So I think that's eating into the existing publicly funded healthcare systems, and unless that force goes away, I think it's going to be difficult to build a resilient system.
What lessons do you think that there are to learn from both recent and past crises when it comes to moving forward to build resilient and responsive health systems?
I think one of the most important things that I have learned, especially from the Asian economic crisis in the past, was that there were governments, even those who were not very well resourced, who made a commitment to keep up their investment in health as one of the major priorities, and they did not permit so-called resilience by cutting back. And so you could imagine that you're trying to bounce back by cutting corners within, in health investment and so on, but that's not the way to go. And I think one lesson to learn is keep your investment up and continue to serve the majority in the country.
What are the key questions that you think need to be researched in the pursuit of resilient and responsive?
Oh my God, that would go into volumes, in fact. But one of the questions that I think is important to research is that how are these larger forces of neoliberal globalization that is driving privatization in countries, in many countries, and also the distortion of the public sector, how is it affecting different groups of people differently? And how does that change according to context? So rather than always assuming women and children are affected, which groups of women are affected? Are indigenous people always affected in the same way in all places? Are there places where they are more able to withstand this, and what can we learn from that? So I think to understand the differences across different groups of population, both in terms of vulnerabilities and in terms of resilience, I think is an important area of research to focus on.
Thank you so much for your time.
Thank you.